Very good evening, friends. Meeting again in the session of Robert's philosophy, and we're discussing the last chapter from fourth year syllabus as well as from Robert's philosophy, that is modern medication and homeopathic principles. Certain aspects about it which have discussed in length, that is different, the allopathic preparations, their effects, their hazardous effects, how it used to produce dangerous effects on body, how frequently the medicines are taken by the public, even at the counter, and all those effects which used to produce a damage to the human health. That's what we have discussed. Certain drugs like sulfonilamide, he has discussed in length and its effects on the body in the form of Steven Johnson syndrome, called as constitutional effect of sulfonilamide on the human being, or sometimes some rashes, severe types of rashes, all those things which happens to be there. So any medicine when consumed in such larger doses used to produce its effects on the body. And homeopathy denies this. Homeopathy says that such types of medications, if you give in a very minute dose, and if you prove first it on healthy human being, and then according to the law of similars, if you apply them, you can treat such types of disorder. So up to this, we have discussed in length the last example of sulfonilamide, which we have described on the page number 281. We were there on last paragraph. Let us analyze this situation. Here we are given therapeutic agent that will kill the invading organism with the corresponding dangerous action against normal functions of the body. Yet potent as this is, it is of no value against the invading organism after that has become established. And are we to believe that its danger to the normal cells of the patient has diminished in proportion to its possibilities of help against the invader? So, see what he is explaining over there in this paragraph is what the medicines which you are using in allopathy, in modern medicine, they are proved in laboratories. And in the laboratories, when they are proved, they are utilized only in test tubes. Their effects are seen in the test tubes, and because of which any antibiotic, when used against that antigen in the test tube, it directly kills that antigen, and that effect, they consider the same thing will happen in the living human being. But it is not just a vacuum like, or it is not just an empty test tube. There are a number of cells which are present. No one considers that what effect that drug has will going to produce on normal cells, and what effect it will going to produce on the invader, that is the bacteria or bacilli. And without knowing that it has been used. If it has been used like that, then definitely it affects the normal cells. Many times those patients who are sensitive or susceptible enough gets a very severe allergic types of reactions of the body. They react violently to that large dose of medicine, and they suffer a lot. So this is what generally happens because drugs are utilized in laboratories and used in deceased human being directly. It has been many years since the possibility of sterile death has been acknowledged. The bloodstream being sterilized of invading organism is aid the death results. And this is again one more thing which was present and which is present. You kill the bacteria and you still there is a death of the human being. If you consider bacteria is the cause of the disease, and if you kill the bacteria, the patient should recover. After killing the bacteria, the death ensues of the human being. Then it definitely indicates that killing the bacteria is not your aim. And this problem happens many times. This is as true now as then, and the danger being may be imminent or retarded in relation to the amount of crude dosage, or retarded in relation or in the frequency of its administration. Careful observers in the both schools of medicine have noted the slow return of normal health of the patients cured that is the acute infection, having been overcome by heroic medicines, or as may better say, by application of forces outside normal functions of the body. Therefore, although the invading organism have been limited in action, the system has to overcome the effects of infection plus the toxic effects of the treatment. So what he is saying, when you use such types of heroic medicine, the word which he is used is heroic. Heroic means bhayanak. It is very dangerous in large doses. And such antibiotics, when used rampantly in the patient in higher doses, it used to kill the bacteria. At the same time, it used to kill the normal cells. And when such combined effect has happened, there is always a slow convulsions. The recovery gets hampered because of it, and patient never recovers so fast. So this is again one more effect which develops because of it when you administer a heroic medicine. So he is explaining importance of minimum dose and hazardous effects of larger doses. So comparison between the homeopathic principles and the modern medication he is doing over there. Now let us consider the sulfonamide in relation to the homeopathic principles. We might consider in the light of our thesis any or all the synthetic drugs, but so far as we know, there has been no effort to exhibit the potential power of the substances through the well-known and thoroughly tried method of Hahnemann, that of proving the remedy on the healthy human being. Such an attempt has been made in case of sulfonilamide, notably by Dr. Alan D. Sutherland. The results of this fragmentary proving were published in Homeopathic Recorder for the September 1940. So this Alan Sutherland was the person who has proved sulfonilamide, the synthetic drug, on human being. And whatever the proving he has done, the effects he has published in Homeopathic Record. It was in September 1940. Such proving should happen. And then whatever the symptoms of the provings are there, on the basis of symptom similarity, you can use that sulfonilamide, not as an homeopathic antibiotic. So you must use it. You can use those medicines on the basis of homeopathic principles, but their effects are not similar as happens to be there in material form. Dr. Sutherland's conclusions were that this substance, potentized, has great possibilities as a homeopathic remedy when we have more clearly demonstrated its field of usefulness by the sure guide of symptomatic outlines that our principles demand. These are the only guides which provide safety in cure rather than uncertain palliation of this condition that the patient later has to overcome through his natural vitality, and else succumb to in some other and more deeply constitutional form at a later date. So what he is saying, Sutherland said that if we have to prove these synthetic medicines which are used in allopathy, it is necessary to utilize the homeopathic principles. You must reduce it fine. You must triturate it. You must prepare the medicines according to the homeopathic pharmacopoeia. After trituration or after succussion, depending upon what medicine you are doing, you are using for the proving, and then proving it on healthy human being, collecting the data, what happens after giving the medicine, the subjective as well as objective data, and then forming a mathematics of that drug and using that mathematics on the basis of law of similars is the only right method of using those synthetic drugs. It is not like just a patient is having fever and instead of giving sulfonilamide in material doses, you are giving sulfonilamide in dynamic doses. It will not going to work at all because that is not a homeopathic remedy for the situation. Homeopathic remedy means similarity in the proving symptoms and patient symptoms. The homeopathic adage that we try to cure the patient rather than disease might well be supplemented by the statement that we do not presume to snatch the patient from the acute illness from which, by the grace of its dynamic energies, he might well recover, acute illness being always self-limiting, to foist upon him a constitutional condition plus imposing drug illness from which he may never recover. There is one more thing which happens many times. Patient is suffering from acute disease. He goes to the for the treatment to the modern medicine medical doctor. He examines, he prescribes his heroic medicines, the antibiotics and all those things. And then patient feels little bit better and again goes into the same state along with new symptoms added by the medicines which were used. And then that state which develops or which becomes a chronic becomes very difficult to cure. Such things happens when you treat certain illnesses. There is a patient with me that there is a one patient with me who had acute fever, pyrexia, and patient was treated with anti-malarial antibiotics, all those things. And suddenly patient has landed into the ARF, acute renal failure. And then it was a combined effect of the medicine along with his original illness, and patient has suffered a lot. So this is a mixed effect when the original symptoms of the drugs, original symptoms of the disease are present along with the medication, and it led to a certain complex, and that complex is a constitutional disease and which becomes rather difficult to cure. So such types of problems arises when you use medications, heroic medicines in such a manner. I have recovered that patient with the help of L serum, a remedy, serum angularis from your Borix madramatica in 7x potency, and patient came out of ARF with the help of that. But such types of hazardous effects happens and it is called as a constitutional difficult disease which develops because of it. The results of homeopathic remedies in such infections as pneumonia, grippe, streptococcus, staphylococcus, and other generalized or local infections have been more remarkable than in any other system of medication. This is a simple way of saying that natural laws upon which homeopathy is founded and upon which our principles are based work just as surely as serious, swift-paced onslaughts of disease as in any other condition. It is true that in some of these conditions, the system is more deeply involved and death more imminent than in any other. In many conditions, we are called upon to treat. It is also true that many of these serious infections were cured before the laboratories were at hand to furnish the accurate diagnosis, and that very often the most prominent results of laboratory diagnosis is to weaken the courage of the physician, the patient, and the patient's family. Now he is turning towards one more thing. There are many acute illnesses with which patients comes to the homeopath. And homeopath treats it not on the basis of name of the disease, but taking into consideration the totality of the patient, the acute totality, and the remedy similar to that his specific state of disposition and mind at that time. And with the help of that, he can treat the pneumonias, he can treat the typhoids, he can treat the dengue, he can treat any viral infection. Any acute illness can be very successfully treated with the help of homeopathic remedies based on this method. We used to apply law of similars, we used to apply law of simplex, law of minimum dose, we used to take into consideration the doctrine of drug vital force, doctrine of drug proving, drug dynamization, and as well as the chronic disease. And when we apply our remedy on the basis of such a scientific method, then definitely it used to produce a perfect results. We can bring the patient out of danger with the help of such medicines. Even though if such a patient who, if you treat without knowing the name of the disease, and once you do a investigation and patient is labeled, now you are having dengue, the patient's confidence is lost, at the same time the physician's confidence is lost. Such a thing happens, actually you will going to give a same remedy and in the same manner. But looking towards the things happens as if he goes into the state of pride. Because we know that dengue is dangerous. There might be happen dengue shock syndrome, or patient may land into the thrombocytopenic purpura. In such types of cases, there might be hemolysis, all those things, and fear always comes out. Instead of that, instead of labeling it, if you treat on the basis of totality of symptoms, you get a very good results with the hand of homeopathic physician. The homeopathic physician recognizes another important principle in these serious states. The more acute the case, the more infection strikes at the life of the patient, the more clearly indicative are the symptoms. So if the patient is too serious, if the patient is showing in an acute grave condition, he will show many symptoms, and those symptoms are very typical symptoms with the help of which you are easily reached to the right remedy. In chronic states, this has been lost. In chronic states, you are not able to reach to the right remedy because there is paucity of symptoms. But in case of acutes, everything is clear and fine. And patient never forgets the symptoms. He will going to give characteristics, and those characteristics defines a right remedy. Obscuration of the symptoms, that is becoming hazy, aspashta. Obscuration of symptoms, unless produced by crude drugging, is very rare in case of acute infection. The homeopathic remedy works regardless of the name of the disease and works, moreover, toward a true and complete cure without sequelae or constitutional involvement. So in such types of cases, when you handle, you get very instantaneous result and you don't have to label the disease. Many of the viral infections, I never used to investigate unless the fever remains for 4 days or 5 days. Generally, on third day, patient is generally better after using homeopathic medicines. Labeling the patient always frightens the patient. If you label you have malaria, he gets frightened. If you label here you are having pneumonia, he gets frightened. So labeling patient always frightens the patient. So that it is always better to ask him that will do investigations if fever persists more than 3 days. Until if fever settles over there, there is no need of investigation. And I think 90% of times you never require investigations in such types of cases. The value of vitamins in the diet has been a burning subject among research chemists and therapeutics alike. The source of vitamins in natural foods and especially raw fruits has been recognized for some time. And of course, sources of synthetic vitamins have been discovered and their use urged through the drug houses. One simple but obvious fact seems always to be overlooked by the manufacturing chemist, that while chemically the synthetic product may be very little from very little from the natural. There is a difference which is recognizable in the results, sometimes far removed in time from the experimental stages. It is hardly likely that a patient would suffer from too many vitamins through a normal diet. A vitamin is normally balanced and the with the other food value. So another topic which is very important is vitamins. It is a controversial topic. What happens in developed countries? The people who have a very good nutritional diet. So there is lack of vitamins is not the problem over there. So supplying vitamins number of times produces a quantity more than required quantity. But when it is in a developmental countries like India, I have seen a number of times there is a lack of vitamins, lack of iron, lack of minerals. Because specifically in females who used to stay in villages, they never gets a very good nutritious foods for their diet. When I asked first time to my patient in early of my practice, I have started it in a very early in 1991 or 92 when I asked one of my patients, you must eat green vegetables both times She said, we used to get green vegetable once in a month. And if I will ask that 2 times I require the green vegetable, they will say that you go to your place, it is not possible to give. And this is a very important topic, a hot topic, which has been explained over there. So we have to take both things into consideration. If you prescribe a iron tablet, people are happy. Okay, you take that, but they are not ready to purchase the green vegetables. This is the condition. If such things are there, then vitamins, iron, multivitamins, supplements, those becomes a controversial topic. In developed countries, the things are different. In developmental countries, the things are different, and that we have to take into consideration. So in developed countries, if you add vitamins, it might produce hypervitaminosis. In developmental countries, when you use multivitamins or minerals, it supplies the needs of the person. So this is on this controversial topic. We'll talk more about it in next lecture. So this is a good topic to be discussed, and it's very much necessary to talk about it. So tomorrow we'll meet again, and most probably tomorrow we'll finish this topic and we'll finish the Robert's philosophy. So thank you being there. Thanks a lot, and we'll meet again tomorrow evening. Good evening.
Thank you, sir. Have a good evening.